Hello and welcome everybody. I'm Anthony Gonzalez and I'm the Senior Program Coordinator with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And I want to welcome you all today to our webinar titled Today's Intoxicant Market and Evidence-Based Prevention Policies. Joining us today is our presenter, Dr. Matthew Rossheim. Before we get started with today's content, I do just have a few housekeeping slides I'd like to share with everybody. Here on the screen should look somewhat familiar as we are in the Zoom webinar format. We do welcome your questions throughout today's live session, but we do kindly ask that you utilize the Q&A feature. We do have the chat enabled, so please feel free to introduce yourselves as well as sharing any resources and reflections as it relates to today's content. But again, we do kindly ask that you utilize the Q&A feature for any specific questions for our presenter. Additionally, we have captioning enabled for today's session, and you're able to turn that on through the bottom dashboard. We also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hacaod.osu.edu. We also, today's session is approved for entry-level CHES credits. In order to receive CHES credits, you must have purchased the CHES add-on. And additionally, you must attend the entire live session and complete the evaluation within 2 business days. The session evaluation should pop up in your in your browser as you leave today's session. If you complete these requirements, you will receive your certificate within 30 days of the live event. We also have a few upcoming events that I'd like to share with everybody. Our next water cooler chat will be taking place on May 12th, and we'll be focusing on asking the right questions about cannabis. Our next free webinar will be taking place on May 13th, and we'll be focusing on leveraging peer education in establishing naloxone education and distribution programs. Additionally, we'll be launching our U-Bet Facilitator training registration here shortly. So this is a free training, but seats are limited. And at this time, it is my pleasure turning it over to our presenter today. Joining us today is Dr. Matthew Rossheim, Associate Professor at the University of North Texas Health Science Center. Thank you so much for joining us, and it's my pleasure turning it over to you at this time.
Awesome. Thank you so much. And thank you everyone for joining today. So my 8-year-old son was on spring break recently, and he was looking over my shoulder as I was writing some emails, and he goes, "Dad, what is Fud Muff Cuff Fab?" And I go, "I don't know. What is that?" He goes, "All those letters after your name." So I told him, it means that I had a lot of student loans. So excited to be sharing with you all about all my research that I've done on the really massive changes in the intoxicant market and implications for prevention policies. So a lot of the substances I'm going to talk about are, have caused a lot of harms. And so in addition to giving talks like these, I also serve as an expert witness in litigation against many of these intoxicant industries, but I do not receive funding from these industries. If you want to learn more about the work that I do, there's a QR code to my website there. I'll have a lot of QR codes with resources throughout the presentation, so feel free to have your phone out and scan some QR codes for resources. I'll have this one again later. Also, not as important, but still important. This is what my bookshelf looks like at work. And the reason being is that I study the types of intoxicants that are commonly sold in the US. You can see a lot of alcohol products, but also in the back there, THC and kratom and things like this. I study the marketing and retail availability of these intoxicants to help guide laws, effective, forms of prevention, enforceable laws that help actually prevent and reduce use. So, how do we reduce use? What are some of the best practices? Regardless of substance use, whether we're talking about alcohol, tobacco, marijuana, 3 of the biggest policy levers that we have are physical availability. If we can reduce physical availability, increase price, and restrict advertising, they're not only among the most effective interventions at reducing population level use, they're also among the most cost effective, and they're all modifiable, which makes them very strong policy levers for prevention. An important framework for conceptualizing how we go about this is the 4 Ps of marketing framework: products, promotions, places, and prices. And that's because this is what these industries use in order to generate demand for their products, to get people to start using these substances, to get them to use more heavily, to foster brand loyalty, encourage switching to their products. And so this is largely how I have the content organized for this, is talking about the different products, their promotion, where they're sold, and the prices. But before we dive into it, I want to start with some terminology, because especially in the cannabis world, there's a lot of misleading and confusing terminology by design. I have a QR code here to an editorial that was just published last week in the American Journal of Public Health that explains this, how a lot of terminology getting thrown around, even very common terminology like cannabis, hemp, adult use, um, recreational, are misleading terminology that are being used. So I open the editorial by, with a simple thought experiment. Imagine if Imagine if tobacco companies had convinced our, lawmakers in society to describe our laws as recreational nicotine policies, or if bottles of vodka were labeled non-medical ethanol, right? It sounds absurd because it is, and yet this same linguistic sleight of hand is being used to promote the commercialization of intoxicants nationwide through these THC products. And so, just to make sure we're on this all on the same page, when we talk about cannabis, it's actually the plant itself. It refers to the cannabis sativa L plant, which produces many cannabinoids. Some of these are intoxicating, like delta 9 THC, which is the most naturally abundant intoxicant in the cannabis plant. Some of them are non-intoxicating, like CBD. Some of them, like THCA, aren't intoxicating in and of themselves, but when you heat it, it converts to regular delta 9 THC. And then hemp that you'll hear being used, that's a legal categorization. This came into play with the 2018 Farm Bill to try to distinguish, and I'll talk more about this, but the marijuana plant from industrial hemp. And so they distinguished this based on the delta 9 THC content. But as it's used in today's market, it does not mean non-intoxicating, it doesn't mean safe and things like that. So I would argue that the market for THC products in the US has been the most drastically changed market in the last decade. What do I mean by that? Prior to 2014, there was nowhere where you could purchase THC products without a medical card, right? So in terms of like the recreational dispensaries, there was nowhere you could legally buy it in the US before 2014. Fast forward to today, there's 24 states that have legalized non-medical use and licensed dispensaries. And also, smoke shops are a major source now. So I've contacted back in 2023 a sample of 10 smoke shops in in every U.S. state, Washington, D.C., and Puerto Rico, and found that in the vast majority of states, almost all of them, you can buy intoxicating cannabis products or THC-like substances in smoke shops just about nationwide. So when you add this and this, essentially what you get today is this: regardless of your state laws, you can buy stuff that will get you high in your state. Um, and this is concerning because we know that retail availability is strongly associated with use, that as access increases, so does use and negative consequences. And we're seeing this in 2024. The National Academies on Science, Engineering, and Medicine wrote a report that they recommended that the CDC, in conjunction with other federal agencies, develop best practices for marijuana prevention, like they have for alcohol and tobacco, including things like restricting the marketing and retail availability of THC products. And as I mentioned, we've seen this reflected in use. So the year after the 2018 Farm Bill was signed, we had one of the largest single-year increases in substance use in recorded history. This was second only to the nicotine vaping epidemic when Juul came out. So THC vaping among 12th graders just about doubled in a single year. In 2022, for the first time in US history, daily THC use surpassed daily alcohol use, according to NISDA data. And currently, more than 1 in 4 18 to 25-year-olds are current users or past 30-day users of THC products. Some people still deny that marijuana use is addictive, and at the same time, more than 7% of Americans 12 years and older are screened at risk of a cannabis use disorder. That's 20.2 million people, which is more than the population of 47 of our states. Only three of our states have more people than those who meet criteria for a cannabis use disorder. Despite how you'll see it marketed online and elsewhere, cannabis itself is not medicine. The plant itself, the flower that people smoke, it's not medicine. With limited exceptions, there are three cannabinoid-based medications that are FDA approved for specific populations with specific conditions. So this includes rare seizure disorders, a pediatric seizure disorder, AIDS-related anorexia, and chemotherapy-related nausea and vomiting when there's like extreme wasting and people have trouble maintaining, body weight that they need to survive. And so for most conditions that qualify patients for state marijuana programs, the evidence isn't there to support use for those purposes. In fact, there was two reviews recently published, one in JAMA and one in Lancet Psychiatry, that demonstrate this. To the contrary, there are well-established numerous harms. I don't have time to go into it there. Again, this is the 2024 NASM report. If you want to scan that QR code, it goes into more detail about the strength of evidence for all these physical and mental health conditions. I've talked to physicians, some of which say that, prescribing marijuana for some of the conditions that it's prescribed for, it's kind of like prescribing alcohol. It might numb the temporary, symptoms of some of these mental health disorders, but it can exacerbate these issues in the long run and introduce a lot of other physical and mental health effects. And some have even likened it to smoking cigarettes, where some people smoke cigarettes to lose weight. And so it might work for that intent, but it's going to introduce way more health harms and risks than the benefit of like lower weight, right? And so that's how I've heard it likened by physicians. And the risk of all of these harms, especially the most severe harms, goes up as potency increases. And so I'm going to talk now about what is legal industrial hemp and what is not. So all of these products on the screen are being marketed as hemp, and I'll give you a hint that half of them are and half of them are trying to exploit legal gray area. But as I'll demonstrate in my presentation, a lot of them are, verifiably violating numerous federal laws. When the Farm Bill was being promoted, the war cry for it was rope, not dope. They said senators made comments like, you need a hemp cigarette the size of a telephone pole to feel any effect. And another senator commented that smoking hemp would only waste breath, time, and lighter fluid. So what is industrial hemp? So the plant looks like this here. It's selectively bred. It's the same species of plant as it's cannabis sativa L, just like these short, bushier looking, like traditional marijuana plants, but it's selectively bred for that long stalk. It almost looks kind of bamboo-like because that stalk, it's useful for the fibers for creating textiles and rope and clothing and other sustainable construction materials and nutritious feed for animals and things like that. Um, it looks very different than the same plant that's bred for its leaves and flower that are useful for cannabinoid extraction, right? And so before the 2018 Farm Bill, nearly all intoxicating cannabis products sold had Delta 9 THC, again, because it's most naturally abundant in the cannabis plant. What's even more abundant than that, though is THCA, which when you heat it, when you vape or smoke or cook the marijuana, when you cook with oil to extract the Delta 9 THC, that it converts the THCA into regular Delta 9 THC. And it can be distilled into very high potency products, like 90% plus products. And so I have this long definition here that was used to distinguish. The idea was to distinguish these two plants, the hemp plant from essentially marijuana. And so they said anything with part of the plant or any extracts or derivatives with very little Delta 9 THC, so no more than 0.3% Delta 9 THC would be considered hemp. And so how the industry has responded, what they're claiming is legal and selling now is, as you can see, a lot of other chemical compounds that are similar to Delta 9 THC have similar effects. So they've learned how to extract CBD, add acetic acid or other chemical catalysts to convert it to other types of THC. And then they're infusing that into food and beverage or spraying it on flour, things like that. As well, THCA flower, some states have not updated their rules in accordance to USDA guidelines. And so they're selling regular just marijuana flower, not taking into consideration that the THCA converts to Delta 9. And then as another thing that I'll talk about is Delta 9 edibles. What some companies are doing is they're extracting high potency Delta 9 THC, which then meets the definition of marijuana, but then they're adding it to like gummy bears and chocolates and saying that that turns it back into hemp because they're including the weight of sugar and stuff like that. But as I'll show you, that is verifiably illegal as well. So what's really confusing is there's three different main buckets of things that are being referred to as hemp. One is the industrial hemp plant and the non-consumable things like the textiles and things like that. Another buck category of products are these CBD or non-intoxicating products. What I'm really going to focus on for the rest of this presentation, though, are these intoxicating THC and THC-like compounds that get people high. So one of the first studies we did is we looked at retail. We looked at several websites that were selling these products that were highly trafficked. A lot of people were going to these websites, and we just wanted to get an idea of like what all different intoxicating compounds are being sold. So in this study back in 2023, we documented 26 different intoxicating compounds being marketed. Since then, we've identified even more. I've also done a ton of calls to smoke shops, and one of them at the time said, look, man, you got to come in. We basically sell the whole darn alphabet. The common forms that these are sold in, they're often sold in the dabs or concentrate, flower or bud, vapes, edibles, and beverages. I'm going to show you what some of these products look like. So this is what oftentimes the concentrate products will look like, oftentimes 99% THCA. And if you multiply it by 0.877, that's how much Delta 9 THC it converts into. So still like about 90% Delta 9 THC by weight. And again, they're marketing as THCA, so that's how they're supposedly circumventing laws. Most of these pictures are taken in Texas, which we don't have legalized recreational, but just in smoke shops, they're selling, you know, nearly 60% THCA flower. There's more flower products. These are some pre-rolls, including ones with some hash oil down the middle of it, um, or hash batter. Edibles here, gummies, chocolates, cereal treats, potsicles, as they're called. So popsicles with THC in them. Marketing, you can see cartoon characters, fruity flavors. THC beverages are a concern for a number of reasons. One is these seem to be penetrating the more mainstream retail channels as well, not just the smoke shops, but also the gas station, convenience store, liquor store, grocery store. Sometimes the marketing isn't entirely clear. Like as you can see, these high seltzers here, they're oftentimes marketed as zero alcohol, zero regret. And while they say D8 infused in the middle, people might not understand that unless they look down at the bottom and see like the little pot leaf and the little 5 milligrams THC at the bottom. Also, some of these are very highly potent beverages, which is another concern. These tend to be more in the smoke shops, but like these 8 fluid ounce ones that have 500 milligrams. And I think this one's even smaller, the syrup here, that's 750 milligrams of Delta 9 THC. And so these are some extremely examples of extremely high dose per container. So, um, the some of the highest that we've seen are like 30,000, 20,000 milligrams of THC, which in most states that have legalized rec markets, they will allow up to oftentimes 100 milligrams of THC per container. So this 20,000 milligrams is like 200 times the THC limit that would be allowed in most rec states. And these are commonly sold in smoke shops. Also concerningly is the types of THC. And so as you'll see some of these that are very high potency, a lot of them also have THCP in them, which is oftentimes marketed as being 33 times more potent than regular Delta 9 THC. And so, it's no surprise that we're seeing massive spikes in calls to poison control centers and emergency department visits and pediatric poisonings and all sorts of negative health outcomes, associated with these products because they're just so high dosage, um, compared to, in years past. More examples of high potency products. High potency per gummy. These rocket ones, they're little gummies that oftentimes have around 1,500 milligrams per gummy. These sour bites ones, the double stacked, those are very popular nationwide. Just a two-pack of them, two little gummies will have 2,000 milligrams in them, including THCP. Flying Horse is also popular. And the 2 bites ones, it'll often be between like $5 to $10 for that little two-pack. Sumo gummies are also really popular, just to give you an idea of just like the small gummies, 420 milligrams per gummy. So this is a little pack has 840 milligrams in it. As I mentioned, lots of different types of synthetic cannabinoids being included. Them, most of them are blends now, so it's really hard to like, in terms of the health effects, studying them. So not only from a public health perspective of like the associated health consequences, but even from like an epidemiological perspective of trying to identify like the health harms of each of these individual compounds when they're sold in such, mixes of varying quantities and things like that, and in different modalities. So in food and beverage and vapes and smoked and high potency concentrate and things like that. So, the variety of different ways people are using a variety of different compounds mixed together makes it really hard to study the health effects. More vapes with a variety of different cannabinoids in them. These looper vapes are very popular. THCB is one. It's not supposedly not as highly potent as THCP, but there's limited research suggesting that both of them bind more strongly to CB1 and CB2 receptors, enhancing the potency per milligram. THCO vapes are also of concern. I don't know how many of you remember the EVALI outbreak with vitamin E acetate, but similar to that, these THCO vapes, when you heat THCO, it forms ketene, which is a toxic gas, and people are inhaling it into their lungs. There's also issues with trademark infringement on products. Gone back and forth with my marketing team about these bag of Cheetos, where they're like, Cheetos doesn't have THC in it, and I have to repeatedly show them that no, this is a THC product. Smoke shops are often selling just straight up cannabis seeds. They'll be labeled as for novelty purposes only, but when you go on Reddit, they'll say things like they feel like most 20-ish types I've smoked, and hey, they have to say novelty. Legally we can't legally sell weed seeds, my man. As I mentioned, blends. So some of them have up to 8 different intoxicating cannabinoids in a single product. So that was the products. In terms of the placement, as I mentioned, not just the smoke shops, but more mainstream. This is a farmer's market, grocery store in Texas, Sprouts, where everything to the right of the Angry Orchard and the White Claw here is different brands of THC beverages that they carry now. Total Wine and More, which is a major liquor store chain. Some probably smart product placement with the cheese balls there, but all of these are THC products. Some THC shots and little what do you call them? Packets of THC liquid, um, right at point of sale, right at the cash register here. This was in a Circle K in Texas, a gas station where they've got THC vapes, THC edibles right next to unapproved sexual enhancement drugs. This is a billboard that was in Houston. Stay hydrated, my friends. So we sell infused beverages. So this is a liquor store promoting THC beverages via billboards. Again, following the industry playbook, the alcohol, tobacco playbook, a lot of stuff that we've banned in many states for other products, cartoon characters, things like that coming up. I don't have time in a 1 hour presentation to go through all of the different federal laws that they're likely violating. If you're interested in that, you can scan this QR code, and I put together a 22-page report on different federal and state laws that are being violated, likely violated through the sales of these products, as well as other intoxicants that I'll talk about that are being sold in these smoke shops. Um, in short, uh, it's it's been a fragmented regulatory system where, depending on the cannabinoids and the modality and how they're marketed, um, and whether it's interstate commerce and things like that, it can fall into different jurisdictions, and it's really hard to build a case against these companies. It requires, you know, product by product assessment and building a case on specific products. And so it's just not scalable. And the penalties to date have been largely civil and administrative. They've been warning letters and, seizing some products and, more financial fines and things like that, or penalties than we've seen for other substances. One of the things I'm going to talk about, though, is that outside of the FDA, some of these products clearly fall into DEA jurisdiction, which they have a lot stronger enforcement mechanisms at their disposal. And so I'm going to demonstrate to you now how a lot of the products being sold as lawful hemp are clearly still meet the definition of marijuana, even considering the 2018 Farm Bill. So how do I do this? I have a paper under review right now where I've done this for hundreds of products that we identified on websites, but this is one example here. Edibles, these are a popular brand of these products. It says right on the label they're 3.8 grams per gummy. There's 2 grams of sugar, which means there's only 1.8 grams available for non-sugar ingredients in each gummy. And so what we did is we calculated if each gummy has 10 milligrams of Delta 9 THC, which is labeled as that, and we also verified using the certificate of analyses. We scanned the QR codes and got the lab test results and verified it for all the products as well. In order to get 10 milligrams of Delta 9 THC from lawful hemp, you need 3.3 grams of cannabis plant material for that to be lawful hemp. And so you can clearly see the issue. You would need to add 3.3 grams, and there's only 1.8 grams available, which means that even under these very conservative estimates, it's physically impossible that it contains lawful hemp. What do I mean by conservative estimate? This assumes that you could take the cannabis plant and add sugar and turn it into a gummy bear, which there's lots of other ingredients. Like if you did that, it would not anything resemble a gummy bear. So these are very conservative. Similar things for other popular brands like 3 and Hometown Hero. This one you would need 8.3 grams, and there's only 3 grams available. And they list all of these other ingredients, and they even give you the playbook of what they're doing. They say hemp-derived Delta 9 THC distillate. If it's only 0.3% Delta 9 THC, it's not distillate in any meaningful chemical or commercial sense. Um, this was the most egregious example that we identified in our study. So this is a 30-gram chocolate bar that was labeled as containing 200 milligrams of Delta 9 THC. Just to have 200 milligrams of Delta 9 THC would require 66.7 grams of cannabis material, which is 222% of the total product weight, which is physically impossible even before you consider that the product is 80% sugar. Beverages, it's even more physically impossible. Again, they list Delta 9 THC distillate, but it's even less likely. Why? Because you're mixing a liquid with a solid. And so in this example, 5% of the beverage would need to be hemp. And so they could do this in a couple of different ways. They could either just take like raw marijuana and do it, in which case you'd see other things like CBD. Like, as I mentioned, CBD is more naturally abundant, or they could extract other cannabinoids as well. But again, the only thing that's detected here is Delta 9 THC in their certificate of analysis, which suggests that they are taking Delta 9 THC concentrate and emulsifying it, which makes sense. That's how you would be able to actually mix it into a beverage. But even if you didn't follow any of that math, the real reason people aren't adding lawful hemp to these food and beverage products is for the same reason that you don't hear about people eating marijuana. One, it's super inefficient, and two, it's disgusting. It would make all these products inedible. In addition to this, there's been massive falsification of lab test results. This is an example of a company that, if you look at their lab report that they list and actually scan the QR code, it takes you to the original lab results, and they just like pasted over the values to show that it's legally compliant. Um, Other companies have taken certificates of analyses from other companies and just pasted their company information over it and kept the same, you know, sample batch, the same values and everything. They just put their own brand over it. Um, Some good news, though, is that we found that state bans are strongly associated with reduced retail availability of these products. And again, that's important because retail availability is one of the biggest determinants of population level use. And so in that same study that I called Smoke Shops All Across the US, we also matched that with state laws, and found that compared to states with bans, vape shops in states without bans had 16 times the odds of selling intoxicating cannabis products. And this is even after we statistically adjusted for things like the active retail of legal non-medical THC, so licensed dispensaries that are operating in accordance with state laws. However, these bans need to still be comprehensive and well enforced. And so even in states with bans, 43% of them still sold some type of intoxicating cannabis product. And it seemed to differ a little bit by state law, and I'll explain what I mean by that in a second here. To the contrary, for other states that had laws designed to limit potency or availability in other ways through regulations short of outright bans, there was no significant association with the retail availability of intoxicating cannabis products. So in states with limited or no regulations, 92% of them sold intoxicating cannabis products. And in states with laws designed to limit potency or availability, 90% sold intoxicating cannabis products. And this is no surprise that the regulations didn't work because it's a moving target. These products are constantly being re-engineered to circumvent these regulations. And so this is what I meant by it differs based on state. So if states really cracked down on THC, they would sell HHC in the smoke shops. If they regulated intoxicating cannabinoids, they'd focus more on THCA products. If they were regulating the isomerization process, then they would just sell Delta 9 THC edibles and beverages. But in most states, they just sell all of them. The We talked about the products, place, promotion. Now I'm going to talk about price. The real price of cannabis has been falling, so it's becoming more inexpensive, which is a major determinant of use, especially among young people who have more limited disposable income. One of the major concerns with this is that if grown at scale, if produced at scale, marijuana will become one of the least expensive intoxicants per hour of intoxication. You could manufacture at scale a joint for a fraction of a penny. And so there's concerns that people will give away THC products at various events or at hotels or casinos or restaurants or things like that to attract customers. And that's very concerning. We're already seeing this in smoke shops, giving free THC products and things like that to attract customers. Some other good news in this regard, though, is that last November, as part of the bill that ended the government shutdown, there was language added to more clearly and more readily enforceably make these products illegal. The industry has framed this as a new ban, but it does not newly ban these products. As you can see in my report, most of them are likely in violation of tons of federal laws, but this makes it much more clearly aligned with marijuana and in DEA's jurisdiction and in states that have, licensed sales. It puts all of those products according to federal law in with other marijuana products, which is how they're essentially functioning in the marketplace. This is how it does it. Changes the criteria for intermediate products to have not just Delta 9 THC, but no more than 0.3% of total THC, including HHC and things that have similar effects of THC, no more than zero point 0.4 milligrams of THC per container, which is designed to still allow for CBD products or non-intoxicating cannabinoids to be sold. But it also prohibits the synthesizing or manufacturing of cannabinoids outside of the plant, so the isomerization process and things like that. So still got a little bit of time, so I'll talk a little bit more about. I want to leave. It looks like we got a lot of questions in the chat, so I want to leave time for questions. But the last thing I want to touch on is the importance of state laws. So even with this change in federal law, it's super important states have their own laws that are easy to enforce and hard to evade. As we've seen, complete bans of intoxicating cannabinoids seem to be very simple to enforce and seem to be effective in reducing retail availability, whereas partial bans almost guarantee this regulatory whack-a-mole. In the absence of full outright bans, modality-based bans seem to be the next best alternative, banning smokable or vapable products or things like that. And rather than trying to define all the intoxicating cannabinoids, doing a specific carve out for things like CBD, if those products, even though they are still harmful, they cause liver damage. We have studies demonstrating that. Um, if the intent is just to go after the intoxicating ones, carving out CBD specifically. The penalties also have to be well enforced. So there has to be some risk of retailers, otherwise they're not going to change their business practices. And it has to be severe enough to not be just a cost of doing business. We don't want the purchase use possession laws. We don't want kids getting kicked out of school or getting arrested or things like that. We need to go further up the supply chain and disrupt that by having large enough penalties, whether they're civil or criminal, to prevent people from selling these products. That said, large quantity possession can help, with laws so that they don't have to do undercover purchase operations to prove intent to distribute. There are other things that the companies try to do as workarounds. This is one example in Texas. There was a ban of THC vapes and then try to sell the liquid separate from the device, even though how it's the law, state law is defined still is clearly a violation of that state law, punishable by up to 1 year in jail and a $4,000 fine. And so they're it's just a testament to the industry trying everything to not necessarily abide by the law, but try to, get away with as much as they can. And enforcement has to be adequately funded in order to be effective and for enforcement to actually do this. Um, so in terms of advocacy activities, there's three main things that I think of in terms of organizing efforts. One is just understanding the mission. So for example, what's our current state law and what's the ideal law and what are the deal breakers? With that in mind, building a team around that, people who can buy into that vision and can are the right players at the table who understand the formal and informal processes for policy change. And then I think a big piece, not only in these are all kind of iterative, but in building the team, it helps to be able to tell the story, but also to elected officials and to the community and, through things like op-eds and things like that, being able to tell the story with local data, whether it's, recent poisonings or retail surveillance of the types of products that are being sold and where they're being sold. I feel like youth have a lot to offer in this regard too. Of I feel like their voice is very strong to elected officials. Saying that in Texas, one of the youth said that there's this store that is right across the street from our high school, and it's where kids have always gone to buy snacks before school, after school, during lunch, and now they're selling these intoxicating hemp products, and it's high school kids selling it to other high school kids. Um, Also very powerful is the mothers groups who've unfortunately had, their children who've suffered tragedies from these products. But being able to communicate that to lawmakers and to the public, I've written a variety of op-eds, many of them in Texas, two of them in Kentucky. One of them was retweeted by Mitch McConnell prior to the November law change, which goes into effect this November. But there's a QR code there too to one of my op-eds. Just as an example, one of them is, I think, a good example of how to get something landed in a newspaper. The initial title, they didn't accept the title, but the title I submitted was "What do Elon Musk and Texas smoke shops have in common?" And so the idea was going back to his The Boring Company. They were sold products that were dubbed not a flamethrower. And the idea was it's a flame-throwing device, but by calling it not a flamethrower, they were able to circumvent laws designed to prevent flamethrowers from being sold in interstate commerce and things like that. So they were able to circumvent customs and shipping laws and things like that. So when Elon Musk did it, it was kind of cheeky branding. People who bought it enjoyed kind of being in on the joke. But when Texas smoke shops are doing it, they're selling not marijuana and not psilocybin and things like that. So I drew some parallels, and I feel like that type of kind of engaging analogies and storytelling helps land it in more public-facing audiences. And then in terms of retail surveillance, all the pictures that you saw were ones that I took in smoke shops. Definitely safety first. The more you do it, the more you practice it, the more comfortable you are. But I oftentimes have my phone out with me when I enter the store and just am able to take pictures as I'm walking around, or I'll kind of go like this, where I'll put it under my arm and I'll take pictures, as I'm walking around, or even just ask to scan a QR code and take some pictures of products. I'm asking about them. Um, and the last main thing I want to talk about is THC right now is just the tip of the iceberg. Um, they are, it is kind of the bread and butter of a lot of these smoke shop models. It's a lot of the revenue they generate is from these THC products, but now they're selling things that act on opioid receptors like kratom and synthetic forms of kratom like 7-hydroxymitragynine, and now it's 8-OH and red-OH and 11-OH and pseudoindoxil and all these other ones. Um, the federal government's already talking about scheduling 7-OH, and they're kind of behind the curve. The industry's already innovating just like they have for these THC products. Other things that act on opioid receptors they sell, they look kind of like caffeine pills. It's super deceptive. They'll be labeled with things like energy, happiness, stuff like that. And if you look on the back, you'll see tianeptine buried in the ingredient list as like the sixth ingredient. But the FDA has dubbed that gas station heroin. And so these smoke shops have basically become hubs for all of the intoxicants that the FDA states are unsafe for consumers to use and illegal for interstate commerce. So you can see in this image other things, these inhalants at the bottom here, the whipped cream chargers, nitrous oxide, nitrate poppers. hallucinogenic mushrooms, Himalayan mad honey, so hallucinogens. These are all products that were purchased in Texas smoke shops. All right, so a bunch of resources for you. One is the Rossheim report here that has the 22-page report on all of the different federal laws that they're, likely violating with the sales of these products. Another one to my LLC's website that talks more about the consulting work that I do. There's fact sheets here that are available on the UNTHSC website about these products. My email address is listed there. I'm going to give you just I think two more resource pages. One is about alcohol. And so, if you enjoyed this presentation and want to hear more about how the alcohol landscape has drastically shifted in the last decade with things like the products, to-go sales and other laws, third-party delivery apps, the look-alike products that look like non-alcoholic and how that increases access, the proliferation of fake IDs, all sorts of issues with alcohol as well. This is a freely available open access paper, so you can read it online or download the PDF for free if you scan this QR code. So another gift for attending the presentation today. And then the last thing is if you want to stay in touch, this is not a list serve. I don't send very many emails. My goal is to send maybe like 3 to 5 per year of just if there's been major changes in federal laws, or if I have like a groundbreaking study like the one that is demonstrating that most of the Delta 9 THC. In that study, we found that over 80% of products that were marketed as legal hemp, those Delta 9 THC edibles, are actually basically impossible. They have to contain marijuana and therefore are marijuana products. So if you want updates like that, all you have to answer is a few questions when you scan the QR code, just your email address, your name, and if you want to check one of the boxes in terms of the type of work that you do, it can help me target messages towards you. But again, I don't do a weekly newsletter. I'm not going to spam you. I'm just going to send the most highly relevant research and policy updates, just a few times a year. So feel free to stay connected. Otherwise, really appreciate you taking the time to, attend this presentation, and happy to answer all the great questions you have.
Absolutely. Thanks so much, Dr. Reisheim. That was fascinating. And the reason I stumble over my words a bit, thinking about where to start, including so much great information. I know when you first mentioned the surveillance study, which I was able to link in the chat for folks, you said, I'm not going to go into that because of time. If you had 3 minutes, what would you kind of highlight from that surveillance study? I was peeking at it a little bit, reading the abstract. So what would you say kind of the highlights now that we have a little time in this Q&A from that surveillance study that you did in Texas?
Oh, the retail surveillance in Texas,
Yes.
that 2020 page report. I would say it was the first time that I recognized all of the different intoxicants that are now widely available. Um, I'm now doing in 2026 subsequent phone calls to vape shops across the US and asking not about THC, but now about all these other kratom products, 7-OH, if they have anything else that's highly potent like 7-OH, nitrous oxide, or whipped cream chargers, and the Amanita muscaria mushrooms that have hallucinogenic effects. And so more than halfway done with the calls, and they're just very widely available throughout the US. And if states have cracked down on the THC, they're still selling a lot of these other ones. Unless there are state bans on these products, they're very widely available outside of states that have bans on them.
Awesome. Absolutely. Thank you. Anthony's got the next.
Yeah, and so if a university, wanted to conduct, an audit or an environmental scan on the landscape of their local intoxicant environment, what recommendations would you have as like first steps for those professionals?
Great question. So I would say that there are a few resources that are could be at their disposal. One is university surveys, and so if there's annual surveys or things like that, health surveys that they can integrate questions and get a read on the types of substances that students are using, updating those to include these substances that are even more widely available to them than even like alcohol products oftentimes. Um, Another would be partnering with health services, whether it's student health services or local hospitals that serve student populations. to be able to identify when students are being harmed from these products and being able to link it back to specific products, getting information, making it routine practice to figure out what specific product, what brand of the product, and being able to put out health alerts that, students are being hospitalized because of use of these substances. Um, and even if you're able to track it to specific stores, if they're able to tell you where they got these substances, being able to hold them accountable for, your students being harmed from purchasing products that were sold at their stores. Um, and I think that makes for great policy advocacy as well in terms of helping shape the retail, pass laws, pass um, university policies that may prohibit the use of these on campus, the storage of them in dorm rooms and things like that. But again, we don't want to be penalizing the kids. We want to be preventing access in the first place.
Yeah, I wanted to provide a follow-up question that came in to that is in your surveillance work that you've done, have you learned like the primary owners like of these companies? Are they coming from like bigger companies that are making several products? Is it like smaller companies that are trying to skirt the rules? Like where are we seeing kind of these products like come from industry wise?
All of the above. There are some very big players in this, and that's part of the some of the litigation is against some of those major players. Um, Whether it's THC or kratom, there are some brands that are basically sold nationwide. But then there are also kind of the more fringe operators in terms of both manufacturers and retailers, where it's just kind of the one-off mom and pop smoke shops as well. And it's not just smoke shops, it's gas stations and convenience stores and things like that selling these products as well.
Thank you. Have you seen much of psilocybin being used in these kind of open markets? The individual references, in Colorado, the law states that psilocybin can only be used under mental health supervision.
Great question. Yeah, so most of them are selling the Amanita muscaria, which has similar-ish effects. Some of them will sell straight up psilocybin, and some of the vape shops that I've called, um, uh, one of them was like, no, no, it's not Amanita, it's psilocybin. And I was like, are you sure about that? And they listed the brand, and I Googled it, and sure enough, it got had warning letters sent to them because their products indeed contain psilocybin. And so most of it's the Amanita muscaria mushrooms, but some of it has been found to contain psilocybin as well.
Maybe talked
But,
a little bit.
but
Oh,
sorry,
sorry, go ahead.
building on that, psilocybin is still scheduled though, so that's why most retailers aren't selling that.
Thank you for clarifying that. Um, Sorry, brain is trying to think of a way to ask multiple questions. And so we'll start with this one is, are you aware of any data that's available on folks kind of using these products, but having like really no clue what they are or what's in them, and kind of not being aware that there's so many kind of unknown ingredients or what's happening to their body?
Yeah, it's really hard. We've done some survey studies asking people about what all they've used, but kids aren't memorizing the alphabet soup that's listed on these, especially with the blends, if there's like 8 different cannabinoids in it. So we've started asking more about the brands of products that they've used and identifying some popular brands that are used. Um, Even the people selling them, even the retailers sometimes are just super confused about what they're selling. I ask them if they sell any THC products, and they say no, just hemp, or no, we don't have THC, and I'll probe more, and they'll say, oh, we got the Delta stuff, and it's all like Delta 8 THC, Delta 9 THC, right? So there's massive confusion even among the people selling these products. So I can only imagine among some of the consumers, especially young consumers, of just having a lack of understanding of what all they're using.
Kind of similar in the kind of same thought process, thinking about, college students and effective messaging. Do you have thoughts on what effective messaging could look like for campuses as, some of these substances are perceived as, legal, semi-legal, or even natural?
Yeah, I mean, it's really hard. We have, for most of these compounds, almost no human subjects research in terms of the health effects. I mean, even the studies that we have on like Delta 9 THC, like it's at potency levels that are like a fraction of what these products that are available on the retail market are. And so I mean, we can show them there's spikes in like, people having psychotic episodes and getting poisoned and having like cannabis hyperemesis syndrome and stuff like that. Um, but from a research perspective, like it's not very well studied. This is all very new territory. And it's really hard to outspend in terms of communication campaigns because they're getting flooded on social media. There's multiple like multi-billion dollar industries flooding their social media, making the products look sexy and cool and it's available to them, affordable. Like so to be able to counter that with some communication campaigns is going to be very, very challenging. What most of my focus has been on is on helping advocate for federal and state laws that can help reduce access.
Are you aware, Dr. Rossheim, of any questions that are available to collect like prevalence data on this that people might be able to add to like campus surveys or um, any type of instrument they're using to collect? Like, how would they be able to learn kind of like what are the behaviors and kind of substances being used on campus amongst their students?
Great question. So it's generally a longer preamble. It's not just like for alcohol, it's simple because it's one chemical compound and you just drink it, right? And so for this, it's all these different chemicals and you want to exclude certain chemicals probably from the item like CBD and stuff like that. And so it usually takes like a longer survey item kind of explaining what you're talking about. And it's challenging too because it's kind of a moving target with this new law going into effect later this year of like what hemp is or things like that. And so we've crafted at various points in time, at different points in time, different wording, trying to explain what, that we're talking about marijuana or THC or hemp products that have intoxicating effects or can get you high or things like that. But it's generally a longer question than like just like, when was the last time you used X, right? Um, so it's challenging. And if you're looking for it like longitudinally, it might be a different question a year from now when the new language goes into effect, redefining these products and clearly distinguishing them from hemp. Great question, though.
Thank you so much, Dr. Rossheim. I don't think we have any other questions, so I'm going to just go ahead and share just a closing few slides. But again, thank you so much for sharing of yourself and your expertise and all of the resource. We greatly appreciate that. Again, just a few upcoming events that we have taking place. Our next water cooler chat will be taking place May 12th, and we'll be focusing on asking the right questions about cannabis. Additionally, we have our next free webinar taking place on May 13th, and we'll be focusing on leveraging peer education and establishing naloxone education and distribution programs. Additionally, we'll be launching registration in the coming days for our UBET facilitator training, but stay tuned as seats are limited for that opportunity. And again, just a reminder that today's session has been recorded and you can expect to see it uploaded to our website within 3 business days. Thank you again, everybody, for joining us, and I hope you have a great rest of your week. Take care, all.